People aren't finding quick, effective solutions to resolve their anxiety disorders. Hey, it's Dr. Shawn Nabors, West Michigan anxiety specialist and practice owner of the Anxiety Treatment Center in West Michigan. Today I want to talk to you about chronic anxiety. In an ideal world, if someone is having an anxiety issue, they would go see a professional who focuses on treating that issue, and then that issue would be resolved pretty quickly. Now, before I continue, I do want to clarify that anxiety is not an issue. Anxiety disorders are problematic issues, and when anxiety starts to impact a person's daily functioning and their ability to take care of themselves, that's when anxiety is classified as a disorder. So anxiety itself is not a disorder, it's not a problem, only when it starts impairing your functioning. But in this ideal world, you would go see this person, this licensed specialist or professional, healthcare professional, and they would help you to resolve that anxiety issue or disorder in a pretty timely manner. Unfortunately, that is not the case in our current state of affairs with mental health regarding anxiety. Chronic anxiety affects a lot of people, and unfortunately, with anxiety, most people tend to struggle with their anxiety issues for abnormally long periods of time, upwards of 5 to 10 years, before they are able to find something effective at managing it. This is a lot higher. This average of resolution over the issue is a lot higher and longer than other issues such as depression. People with chronic depression are typically able to find some sort of help with that depression and find some sort of resolution over those symptoms in a shorter fashion. So on average, people with depression typically are experiencing that in a chronic way from 3 to about 5 years, whereas chronic anxiety is almost double that. People with anxiety disorders, they are typically experiencing that from anywhere from 5 to 10 years on average. So what's happening here? People aren't finding quick, effective solutions to resolve their anxiety disorders. As a specialist, what I see is an over-focus on symptom management is what prolongs a person's anxiety issue. When you are over-focused on reducing your anxiety symptoms, you create a lot of issues for yourself that actually maintain that anxiety issue. Anxiety is pretty unique compared to other disorders in that it doesn't help to be very symptom focused with anxiety. Now, I've got other videos on when it's important to be symptom focused, and you can check those out. But if you're struggling with chronic anxiety, as a specialist, I can assure you that you're probably too overly symptom focused. So how should you address anxiety if you're not focusing on symptoms? Well, you need to focus on building resiliency towards the anxiety, towards the feelings, towards your triggers, and really practice leaning into that anxiety in a very skilled way. You want to find therapists, doctors, specialists who are going to help you to really focus on leaning into that anxiety in a skilled way so that you build skills for managing the anxiety, you build a stronger tolerance for the anxiety, and ultimately it becomes a very manageable sensation, and those triggers become a lot more manageable, and you start to become a lot more functional. So in terms of chronic anxiety, that's what I see and why it's such a long-term chronic issue compared to other issues like depression is that the primary approach to treating it is heavily symptom focused. And it needs to shift from being more symptom focused to being more what I would call an adaptive focus. So basically that's helping you to better adapt to the experience of anxiety so that it's less problematic for you over time. As always, thank you for stopping by and take care.